Hello, everyone. Welcome to the University of Toronto Joint Centre for Bioethics Seminar Series. I'm Andrea Bianchi, and I'll be one of the moderators for today's session. Our speaker is Andrew Jameson, and the seminar is entitled Bioethics for the Anthropocene. Today's seminar is hosted in partnership with the Centre for Sustainable Health Systems. Before I pass it over to the primary moderator of today's talk, Dr. Fiona Miller, I'd like to let you know that this seminar is being recorded. This lecture, along with other archive lectures, can be accessed through the Joint Centre for Bioethics website. The format of our seminar is a presentation by our speaker, followed by a facilitated discussion period. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Now it's my pleasure to pass it over to Dr. Fiona Miller, who will introduce today's speaker.
Thanks so much, Andrea. So yes, I'm Fiona Miller. I'm a professor in the Institute of Health Policy Management and Evaluation. I direct the Center for Sustainable Health Systems at U of T, and I also direct a national initiative for climate action and awareness in healthcare called Cascades. That's funded by Environment and Climate Change Canada. I'm really pleased to be working with the Joint Centre for Bioethics in sponsoring this session. This is one of a long series of seminars for the JCB. It's one of a smaller series of seminars for us aimed at catalyzing research at the intersection of healthcare and sustainability science. Why, you might ask? Because healthcare comprises a significant proportion of the global economy. It's a resource intensive and highly polluting service sector, and at the same time, it's a critical contributor to productive and fair societies. So the health sector has an important role to play in addressing the climate challenge, and research of all sorts will be needed to advance that. And so that's really the intro to why I'm so delighted to introduce Dr. Andrew Jameson, who's a professor emeritus in the Department of Health Promotion at the College of Public Health, University of Nebraska Medical Center, and also an affiliate faculty of the Center for Bioethics at the University of Minnesota. Andrew's research focuses on balancing human welfare with long-term environmental costs, with particular emphasis on adapting the US healthcare system to climate change. He received his PhD in philosophy at the University of Washington in 1972, and really since then, until his retirement, and still his retirement in 2013. He's been a faculty in medical centers doing what a lot of JCB folks do, teaching clinical consultation, administration, and research on ethics and philosophy in healthcare. I was really privileged to connect with Andrew because of his recent article with Jessica Pierce, Can Clinical Ethics Survive Climate Change? And this was a critical reflection on his 2003 book, again with Jessica Pierce, The Ethics of Environmentally Responsible Healthcare. So as you can tell, Andrew has been thinking about and writing about this work for a long time. Indeed, in thinking about preparing to introduce Andrew today, I've realized that some of the earliest pieces that I ever read about sustainable healthcare, a piece published in the CMAJ in 2001, was published by Andrew. So I can think of no better person to help us explore bioethics for the Anthropocene. So over to you, Andrew. Thank you.
Well, thank you so much, Andrea and Fiona. I take it my slides are up and I can charge on, is that right?
Yes, perfect.
Okay, thanks. Just a warning to philosophers. I thought actually Fiona did a nice job of summarizing my talk. It's not really about the Anthropocene. So if you came here for that, we're of course in it, but this is not about it. And I'm going to be focusing on healthcare adaptation to climate change. I know mostly about US healthcare, and I would like to be able to pretend I know something about Canadian healthcare, but it's probably not a good idea, as it's hard enough to keep up with things around here. Much less to know what's going on in Canada. I'm hoping I'll hear more about it in the discussion. Also, I think for some people our focus is odd because I think most have been thinking about the environment and health and the needs of societies are pretty clear that the US healthcare system is kind of an expensive outlier in those terms. And also there might be an illusion that it really contributes much to public health, but most studies show it doesn't. And that at least in responding to climate change, it's public health, built environment, environmental work, regeneration, economic policy, and governance that are needed to reduce health problems. Nevertheless, I think healthcare will continue to be very much needed. And so I think we need to talk about it. The talk is going to be a little bumpy. I always try to get them organized, and one way or another, they turn out not to be very well organized. And there's a lot of material to cover because the argument's kind of broad. It's global, it's about the future, it's about healthcare, and these are all enormous topics. And I think the background to the talk, Fiona, is pretty well done for us. There was a book in 2004. Larry Churchill out of North Carolina asked us to do something, Jessica Pierce and I, on the book and kind of what our thoughts since. So I'll say a tiny bit about the book and a couple things that have been going on. What the book did basically was around, it happened in the 1990s actually. We started to look around the health center and we weren't looking so much at the beds anymore or the nurses or the physicians or the people at all in some ways, except those other people there. Kitchen staff, environmental services, transportation, and many, many other departments, engineering, construction, remodeling, electricians. It's a huge enterprise. And we're noticing things about the building itself. This is a new transplant center that was new when we were working. You can see in the picture the stack of one of the power plants. I think we had 3 on campus. And if your campus is like mine, as you go up and down the stairs and the landings, you find these strange pipes and wonder what's going through them and who goes by and checks them. The upshot, in a nutshell, of our book was the idea of a green health center that would be sustainable in a changing environment and had a connection with the natural world that made sense. And we called it the Green Health Center. So that's a 2004 idea of those sorts of things. I want to give a hooray to my co-author, who I think right now is out trekking somewhere in the backcountry of Utah. But she was very influential in helping me, at least, to recognize the natural environment on which health depends for humans and other creatures, and has written, I think, since we did our book, 10 more books on animal-human relations, animal intelligence, and behavior. And one of the, I think, most touching books she's written is on dealing with pets when they die. Meanwhile, as Colbert says on his late night show, meanwhile, I have here one of these charts that's been floating around Twitter. Let's go back here. I was born somewhere way back here when the world population was about 2.5 billion people. Our daughter, Marcia, my daughter, was born here, and our son around 1970. Our book came out around here. Well, let's see if I can find it. Around here, in the article here. And you'll notice there are all kinds of important things that have happened and have been done. And yet the situation still has not been addressed. Here's the 2000 mark. Here's 1990. The earliest article I can find by a bioethicist on climate change is by Dale Jameson. And what got me going was the 1991 Scientist Warning to Humanity. And I didn't really get convinced about climate change until the 3rd IPCC report about here. So just I don't know if you need that much history, but there it is. Where we're headed in the talk is to get down to clinical areas and the ethics of those, which we called in the article clinical sustainability. And we have a real clear sense that justice and welfare that are local, that is at the bedside, need to be considered in a global and environmental frame. And coming along are the concepts of planetary health and One Health, one from healthcare and one from public health, and one from veterinary, which focuses on this human, say, universal organic ecological connection. And and so the sense of biological connection has been rising to great importance. And I'll say right now, when I hear other people talk about everything's interconnected, I think what idiots. But when I say everything's interconnected, I think it's really important, and we need to talk about it. So I have some ambivalence there. I'm going to go through, and I think I can do this on time, 5 general areas that kind of shape this up. And this is all very general stuff. I'm going to do a quick background on climate change, focus on a topic around limits and limitations, talk about healthcare system adaptation, some clinical ethics aspects. And then the stuff I really want to be sure I get to is there are a bunch of things that have really been puzzling me about all this. And I think I want to tell you all about it. So, and it's probably puzzling you as well. So here's the background on climate change. I think one report will do for all. This is last month's Working Group 2 report that came out of the 6th IPCC assessment. And there's not any good news in this. I mean, there's a little bit, but not something that changes that curve. This is kind of their last line in the summary. The cumulative scientific evidence is unequivocal. Climate change is a threat to human health. Any further delay in concerted anticipatory global action on adaptation and mitigation will miss a brief and rapidly closing window of opportunity to secure a livable and sustainable future for all. In the 7th chapter of that report, it's a 3,000-page report. There's a health section, and this topic has been so well covered. I won't say much about it, but there's thousands and thousands of articles about the health consequences of climate change with varying estimates of seriousness, but they're all fairly grim. Some are on the health conditions and themselves, like cancers, infectious diseases, asthma, cardiovascular disease, and youth aging, prenatal and childbirth effects, and so on. There are immediate kind of health effects that are close to people that do these things, like particulates and ozone in the air, heat, undernutrition, unsafe food and water, the spread of certain vectors. We have ticks around here spreading, and maybe you do also in Toronto, and so on. And then there's things that are more like events that have large health consequences, like floods, cyclones, wildfires, and so on. Heat waves, of course, quite important, but there are also somewhat longer kinds of things like multi-year droughts and crop failures. And there are huge effects also on activities which are health related, like work outdoors, sports, travel, and so on. In that chapter 7, they emphasize some things I hadn't noticed in earlier reports, so they may well have been there. Effects on mental health, more emphasis on malnutrition, connecting health with well-being generally, and then things that I know it's talked about a lot around here: migration, displacement in and out of countries, and the potential for violent conflict is something I think is new in these reports. And noting that the level of investment is not enough to obviate these sort of things. And they call for a transition, which is a word Jessica and I like, toward equitable low carbon societies. There's also more emphasis, that had been around for a while, on loss or losses and damages, which island nations are pressing on. There are hard limits to adaptation where climate impacts are so severe that no existing adaptation measures can effectively prevent losses and damage. So they're looking for compensation, and you may well imagine that wealthy countries are resisting acknowledging these sorts of things. But I think we have to acknowledge that, at least from a certain point of view, healthcare is one of the compensations society can offer for the damage it tends to do. There's every reason to think we'll go past the 1.5 degree centigrade goal that we're hoping for. And there's so many reasons it's hardly worth talking about, but I do have sort of one graph. This one also has been floating around the web, but I couldn't find it, so I drew it without metrics. But here we are in 22 2022 now, and a lot of us are thinking the window runs to 2030, maybe with luck 2040, and on to 2050. The trend on carbon dioxide in the atmosphere is still up. The commitments globally add up to only partial solutions toward a net carbon goal somewhere in this range, and the target needs to be this. So it looks like what we intend is something that won't do the job. At the press event that announced the report, Antonio Guterres was, I think, said some of the strongest things I've heard about this. So today's IPCC report is the necklace of suffering and a condemning indictment of failed climate leadership. With fact upon fact, this abdication of leadership is criminal. The world's greatest polluters are guilty of arson on our only home. Fossil fuels are choking humanity, and humanity may pay the tragic price. It is time to turn rage into action. Now, one of these actions, turns out, and it's difficult to understand, is that there are limits and limitations that climate change is imposing increasingly. And Fiona asked me to just particularly talk about this, so I will spend a little time with this before we get on to healthcare. One reason is, at least this is my experience in bioethics, that over these 50 years I've been around, and this is a sort of cute and unpleasant way to put it, we've been making the world safe for technology because we help to translate new technologies to patients in the public. We help people develop policies that figure out which ways they can be applied humanely, like the respirator, and which ways are more problematic. We help with the IRBs, which judge the ethics of experimentation on these sorts of things. But I think by emphasizing patients' choices and needs, helping practitioners to sideline larger social and environmental conditions, we've tended to warrant technologies that ignore substantial limitations in the capacity of the planet to support them. I'm going to pick on this study because it's so strong in what I would consider dark humor. This was an article on things of using big data systems, which I don't think is really a bad idea, to help deal with diagnosing and treating patients. And in the language is this kind of Prometheanism that I thought, should I write these people? We're going to have huge cohorts, huge data sets, huge interoperable longitudinal cohorts, huge populations, huge genetic studies. All right, and huge is the right word. I pictured up here a couple Google data centers. One I used to drive by back in near Omaha, and this is a set of pipes in a data center where I would say the main function is warming water and moving it away. Now, the way environmentalists often talk about limits is they say, look, exponential growth on a limited planet can't succeed. Eventually, we have to stop. And I get the image, and the warning is important and clear, because somewhere you do have to stop, and we do have economies committed to exponential growth, and we've had exponential growth in population as well. And yeah, there are limits, but where are we? Are we early on in this, the middle? Are we near the end? As it turns out, we're near the limits. And there's a lot of evidence and different kinds that tend to show that. And I won't go through them in detail. I've listed some of the evidence here. But I'll go through, I think I've got 3 of them, and then some temporal considerations about these. This is one sense of limit. This is about what it costs to keep people well and healthy in different countries. So we have a graph here along the x-axis here are the biophysical boundaries transgressed. And this is based on the Stockholm Resilience Institute's model they've had around since 2009, talking about the various areas in which we've gone dangerously past what the Earth can handle and where some of those limits might be. And these are kind of expert judgments put together. But climate change is there, but there's so many other things, some well estimated and worrisome, like the nitrogen phosphorus flow. Some show things that we worry about a lot, like water, but they don't show that as big as a problem as it might be. And so on. Then there's some things that are not well estimated, like toxics, but they're I think it's now 9 kinds of things. On the y-axis, there's social thresholds achieved. And this is kind of on the social justice system that Kate Raworth, or Rayworth, I've never heard her name pronounced, the donut economics. It kind of targets a middle ground of where we might be environmentally sound and where we might do well for societies. China is here doing pretty well in this average range. India's down here. The US and Canada are up here with very high costs. And the costs are here, sorry, and very high welfare achievements. Where you want to be is over here. And it's all empty over here. And there are many other graphs that show something similar. And there are a couple places where you don't want to be. South Africa often shows up over here. Russia does too. And there are other countries that, depending on your rules, that show up differently. Now, what's needed is somehow we have to get this group here moved over here. But how do we do that? No one has a plan yet that's going to likely to succeed or is adequate to it. Another way to put it, and it's very similar with the justice emphasis, is that half the world in population uses about 10% of, consumes about 10%. I would say their lifestyles consume about 10% of emissions, and there's the richest 10%, which this was done 2015, that consume about half. So what you really need to think about, the justice problem is here. And most of the talk is about here. And I think for a very good reason, we don't emphasize these things a lot, is that the people here tend to be very powerful, can hire a lot of lawyers, own a lot of things. And if you start to target them directly, then it's difficult and a problem. But this is where the justice work needs to be done. So one is the welfare problem. The next is the persistence of global poverty. Philip Alston, working for the UN, wrote, I think, a very interesting report just a couple of years ago, where he traveled around the world and checked on the reports of various countries of how they were doing. And he found a lot of spin, mismeasurement, and so on, trying to make countries look good, when actually he thought there was a great deal of poverty still persistent. Another measure, and now very important and increasingly important, is the condition of the natural world. And this, as I've mentioned, is being emphasized more by people interested in healthcare with the idea of planetary health. And there was a big meeting last year on kind of trying to get a big picture of human dependence on the natural world. And it basically saw that people and nature are dynamically intertwined and embedded in the biosphere, and things are not going well in that area. So there are many measures of the state of nature, all of them on the decline. And I'm sure you've heard about the 6th grade extinction, where the species extinction rate is much higher than background. You may also have heard about human appropriation of net primary production. This is the goods, glucose and oxygen and those sorts of things, nutrition, that autotrophs, those that get energy from the sun, use, and humans have been dominating that for quite some time. There's a recent estimate that's kind of charming for me, because I kind of like, oh, here's a big picture, where we estimate the overall biomass of the various sections of the world living ecology. And they use dry carbon weight. That is, you take the organism, take the water out, take the non-carbon elements, and you get a nice carbon comparison that you can use some sort of, well, let's say it's a decent estimate. This is the first of two graphs I'm going to show you from the recent report that was done by Bar-On and Milo. As you see, this is kind of overall, plants dominate in biomass, the global ecosystem. A good thing too, because they're autotrophs for the most part. Bacteria, archaea, and protists are very important too, and often are autotrophs. And in any way, as many people have argued, the multicellular animals are basically the result of an agreement among the single-celled animals. Notice the viruses over here are so tiny, I can cover them with a spot here. And someone estimated, well, how much if you weighed up all the COVID virus would there be that you could measure in terms of carbon volume? Turns out to be about a cup. But here's the animals, very small. This is what we pay the most attention to, and of various kinds. But let me call your attention to wild birds, tiny, wild mammals, tiny. SMIL estimated to decline about 90% in the last century. Humans dominate 60% of all birds by carbon weight are poultry, and so on. So there's this human dominance that say, look, we are kind of near or as far as we can get on development. We need also to consider timeframes. That is, a lot of activities now going on and investments go well beyond 2050 and are problematic. New hospitals, I think you want them to last maybe 100 years. So no one, I don't think, is really fully designing for what to expect in the late century. One of the more ominous things was reported, commented on by the late Tony McMichael, who was one of the early commentators on climate change from the public health point of view, and has written a couple of books about it. But if we keep things going as they are, it looks like Earth's surface may not be habitable for mammals by around 2300. So you figure, thinking of bumpy rides, going to 2300 could be very difficult. Also, and this comes from the Potsdam Institute, they've identified a number of tipping points, a lot of them ocean-related and polar-related ice, that once destabilized could permanently put the Earth into a hothouse state. So we need to frame limits better. We're not to be asking, well, how much further can human development go, but just understand that we need a low energy consumption strategy to stay far from the limits of development capacity. In fact, we need to shift back. What does this mean for healthcare? I'm going to zip through this section. Of course, healthcare needs to adapt as well as mitigate. Healthcare, as Fiona noted, is highly impactful and a big part of the carbon dioxide emissions problem. People are greening healthcare, and it's important both because it's costly and because it's important to people. But I think it has a kind of crucial social function that if we can stabilize healthcare and keep it from collapsing, that we might be able to do better at reducing other forms of consumption and also help to slow or prevent the destabilization of societies as a whole. Now, lots of people are addressing these issues. I've made a list, but I'll just mention a few, and there are many more. Healthcare Without Harm started in 1996, added a group, Practice Green Health. They've been very active and influential in this area, have excellent seminars, webinars, and materials. Next meeting is coming up later this year. That's a Clean Med meeting in Kansas City. They worked with WHO at COP26 in Glasgow on climate smart healthcare and got some commitments from countries to decarbonize their healthcare. And there's a report connected with that, which is quite good. The NHS in the United Kingdom has been working on sustainability. I'm not sure how long, but before any of us. And they have a well-developed program, although caring for our planet maybe not necessarily be caring for our patients. That's one of those puzzles. Brand new program in the US, the Office of Climate Change and Health Equity, headed by John Balbus, which is now working on these things. The National Academy of Medicine here also recently got going on decarbonizing the US health sector. And there's a meeting coming up just next week to talk about their activities. I won't talk about this for right now. I think one of the things that just came out and I thought reminds us of the kinds of things that can and need to be done. This is by Alina Perlman in Heidelberg with a group looking at clinical guidelines and seeing which include some consideration of climate and environmental concerns. And that's the sort of work that needs to be done and needs to be done with some ethical considerations. As I said before, we kind of like the transition vocabulary, partly because the climate smart vocabulary, which I have a little trouble with, is sort of self-flattering. Climate positive healthcare, I like a lot. That's Fiona's group. You need to warn about mitigation and adaptation, usually when hospitals talk about resilience or sustainability, they don't make it clear whether they're thinking mitigation or adaptation. You can mitigate and cut your carbon costs so much that maybe you're damaging patient care more than you need to. And you can adapt in ways that don't mitigate. I think particularly hardening of hospital facilities is in a way maybe important and adaptive, but not very mitigative. One way to envision our Green Health Center, it's about transition, but it's also about finding a way to collapse to the core of healthcare. I like this analogy of our public health building, which was recent and LEED certified. I'm going to take a swig here. It has a core, a tornado proof core. So you might think of building within healthcare those core functions with people loyal to them, patients interested in them, which as things fall apart, you can fall back toward. Clinical ethics. Let's just say one way or another, since it comes down to the bedside, this comes down to the ethics of patient care. And in our recent article, we identified some of those areas and made a few quick comments about what it might be like to include climate change as a consideration. And with technological innovation and setting limits, we've talked about that. Care of the dying is kind of a win-win in the sense that we've already thought there's way too much of that, and climate just adds some more stones to throw at the idea of overtreatment of the dying. There will, of course, have to be more allocation or limited resources, and people are not going to like it, especially people used to the old ways and with a sense of old traditions and ethics. And so we'll be looking at rationing and justice, which is so complex. I'm not going to say much here, but bioethics tended to put it in the periphery of discussions, and it needs to be more central. I'll talk a little bit about patient involvement here because it's so important in bioethics. We in our books said, don't involve patients. First, if you have patients who want green materials and others who don't, then all of a sudden you have two lines of materials and supplies, one green, one not green, and if you stock all of those, you've defeated your efforts to make service more efficient and less environmentally costly. Also, a patient's very sick, has cancer, and you don't want to say, well, your cancer medication is going to actually damage some trees on the West Coast. Maybe you should think about that. I think that's a terrible thing to do in patient care. Patients often don't have any better ideas about climate change than administrators. And in some ways, it's really not part of the patient's job or autonomy to decide or have the authority for managing organizational resources. But there are reasons to talk with patients. Some patients, I think, would be happy to abnegate themselves from extensive care because of their environmental concerns and would sign up for our Green Health Center. Some conditions are more understandable and you don't have to blame yourself if you understand a larger picture. There are vulnerabilities such as asthma, which are likely to be affected as things heat up and air quality gets worse, and people may need to prepare. And also, if the hospital or the profession is working locally on issues around greening and cutting the carbon costs of the urban area or rural area, patients may want to be involved. So there should be some way to invite them without pressuring them. There's a new case or two that I think struck me. I saw something like this in a recent article that I reviewed, and I don't know who the authors are, and so I want to credit someone whose name I don't know, and I don't know if their article got accepted either, but I said it was fine. So there's a conversation that recurs between the unit medical director and the hospital sustainability officer about proposed changes in supplies, tools, or equipment to reduce environmental or carbon costs, and it might affect the quality of care. A nice example is, well, could you use your ventilator tubes a day or two longer? The infection rate won't be very much up, and it'll cut in half the environmental cost. Do you want an ethics consultant to help balance these separate concerns? I think you do have to think ethics, since they are about balancing high quality care with environmental costs, and there are all these complications of role and authority. I heard Jonathan Slutzman last week in a nice talk for Healthcare Without Harm. He suggested there needs to be a new job, which is the medical director of sustainability, which would combine these two roles. And of course, that may well be a very good idea, but that doesn't mean that person doesn't also have to make the same ethical judgment and might need some help or want some help. So here we go to the puzzles, the things that are bothering me for this last 17 years. I think I'll just say a couple of positive things. I should be able to finish within 10 minutes. So this is the last section of the talk. One of the things that impressed me lately in looking around for stuff, there's so much creativity and inventiveness in language and concept, which I think is a reflection that people are, A, struggling with what needs now to be said, and B, have a lot to offer and are excited about it. Some terms that I'll just mention here: ethno-veterinary care, geoethics, anthroponymy, horizoning, one of my favorites, pre-eco-catastrophe sensibility, the Pandomacene, A-leaf as opposed to B-leaf, northern ventriloquism, all too true. And I think in some ways my favorite, because I don't understand it, is hauntology. But there are great tasks here for philosophy. When things are falling apart and are getting really interesting and society's norms and values are not working, now it's time for philosophy. And so we, in our work, I think, have both a responsibility and opportunities here, and others recognize that. Otto and others who are working with the tipping point idea have identified some social tipping points, and they consider norms and value systems as one of those areas in which work needs to be done, and I more than agree. Here come the puzzles. The one that most bothers me, I call the anthropological puzzle. The main purpose of the culture, at least according to many anthropologists, is to sustain a society and an environment. So you would think societies in general would place them, sorry about the voice, that societies would place a high value on preservation of its natural environment. But this seems to be relatively rare, although not unknown. Donald Brown did a big survey a few years ago, didn't find it much. It's a famous article on religion that came out many years ago, noting the lack of environmental protection in religion. And if you read Beecham and Childress and the common morality they appeal to, nothing about environment in those basics. And yet this sentence has just been, well, here we go, hauntology has been haunting me. An acceptable system of ethics is contingent on its ability to preserve the ecosystems which sustain it. An acceptable system of ethics is contingent on its ability to preserve the ecosystems which sustain it. The next puzzle is, I don't think anyone intends climate change. And there's an old doctrine, Catholic, that talks about sort of the ground rules that they would accept in abortion, which they would see as wrong. Yet there are things that might lead to an abortion or a miscarriage, medical procedures. And they say, well, it's okay if the harm's not directly intended. It's not a means to a harmful end, and the good outweighs the harm. And in some ways, the whole story of fossil fuel-based society is one in which so much good has been being done that it's outweighed the harm, at least in our minds. And what is happening now, those old ways of more industrialization, more innovation of so many things we can do without considering the costs, is the costs are getting more and more. This is sort of a horror picture. This is just from a Google map of a highway complex near where I live. And I look at this and I think of all the cicadas buried under this concrete that will never live to see the light. Think of all the habitat for squirrels, birds, rabbits, and other mammals that has been taken away here. And think of the human lives lost as well in traveling on these. And then there's the carbon cost of concrete, which is notoriously costly. So can we in philosophy write more for people, not about our choices, but about our unintended acts and our unintended aims? And there's not a lot in philosophy on unintention. And yet people say things. Christy Ebbe, who's done great work on climate and health, says the future's in our hands. The adaptation, mitigation, and development choices we make will determine our futures. And another, Belinda Ryers at the Stockholm Resilience Center. This is all about making choices. And now look at all the choices that are being made along this and what is not happening. So do we really have a choice? I've worked a lot, some years with Physicians for Social Responsibility, and we founded here Health Professionals for a Healthy Climate, which is doing very nice work. The people in the group are activists. They want to carry a public message. But in philosophy, we push so hard for just stating what's the truth, the blank truth. And if you're familiar with the literature on death and dying, you know, you have to take some care with these kinds of things. So where can philosophers with their clarity be helpful for activists who I think rightly see optimism needs to be maintained, and at the same time tell the truth about it? This is an old problem in clinical ethics for individuals, and now it's a big scale problem with the big death around climate change and the larger social movements that need to move people while still telling the truth about what's going on. So are we even right to do philosophy in the way we do? And should we be tolerating more ambiguity and more healthy thinking, shall we say, rather than rational thinking? This quick list of some activist groups, I'm making a bibliography available after the talk if anyone's interested, and I'll tell you how to get it. But this list is on there. Next thing is, if we're going to do this work, and we're already doing it, we need some way to index both quality of care and environmental costs. And I seem to be working, and I think others are, about a kind of general consequentialist formula, which has a long history in ethics and philosophy. The idea is that the general good here in the specific application involves somehow building human welfare and happiness while measuring the environmental costs against it. And J and K are basically weighting factors that it really takes some notion of ethics or theory or proper indexing to decide how to weigh these things. And if you change these factors and make different judgments about them, you find different groups of people in societies doing better or worse in a different order. Now, here's the biggest problem with consequentialism, and we're back to being haunted. This is David Archer, a book, The Long Thaw. So he looks at using a gallon of gasoline to drive your car. And we add up the total amount of energy trapped by the carbon dioxide from the gallon of gas over its atmospheric lifetime, which has a long, thick tail. We find that a gallon of gasoline ultimately traps 100 billion kilocalories of useless and unwanted greenhouse heat. The bad energy from burning that gallon ultimately outweighs the good energy by a factor of about 40 million. So back to my little equation here. So we're going to find a cost here of 40 million and a benefit here of 1. How am I going to fix that? And a little note here, I was just trying to figure it out. A billion kilocalories is 100 billion kilocalories. That's this figure here. It's 110 years of food for one person at 2,500 kilocalories a day, which would be a standard diet, I think. That and standard US cost for food, $3,000 a year, 110 years, that's $352,000 for that gallon of gas and energy. So if you're complaining about fuel costs, I think it could be as high as $350,000 a gallon. Now we have a historical problem here. I'll rush through it because I do want time for discussion. Environmental ethics and bioethics have been split. Environmental ethics people talk a lot about health and environment and biology and public health. They almost never talk about healthcare because I think they'd have trouble having suggestions. In bioethics, we hardly ever talk about the natural environment and climate change. We have common roots with Potter. The environmental movements are not working with the healthcare access and activist movements, and the healthcare activist movements are not working with the environmentalists. So here is I think, a tragic divide which needs to be fixed, and I think philosophy can help. But I want to make sure we get to discussion. So just mention that I think in some ways, although it seems like healthcare is so focused on cells and sub-body issues that it really can't take the environment into account. And the environment is so global about the earth that it can't take these local, personal things into account. But as my friend Philip Peterson notes, that really the important creatures on earth are the single-celled creatures. And in some ways, it all comes down to finding some sense of unity among the macro vision and the micro vision. So we need a program. This was a nice quick one. We need to ensure our demands on nature do not exceed sustainable supply and increase our global, and we need to increase our global supply of natural assets relative to their current level. We need to adopt different metrics for economic success, and we need to transform our institutions, including healthcare and systems. But as he mentioned, finance and education. And I want to add, as part of that, our cultural foundations, which philosophy can help with, to enable these changes and sustain them for future generations. So mostly I've been trying to talk to philosophers about the importance of paying attention to these larger environmental things. Just a message for those already, like Fiona and her group, doing active work on healthcare sustainability. I want to say ethics has your back, but where's the literature? So I say, well, at least it ought to, but since ethics ought to have your back, it does. And one last slide, I just had to show this obscure lit ref for some. So Hegel, who said the owl of Minerva first takes flight with the twilight closing in. That is, philosophy tends to come late to issues. The worry is it might be too late. So the park ranger is saying to Professor Hegel, but I'm sorry, Professor Hegel, we're all out of owls. Deb is available, write me here. I'm ready to discuss.
Brilliant. Thank you very much, Andrew. Do you want to take down your slides so we can get a better view of you? That's super. So thank you. That was wonderful. We do have some questions coming in, but I'd like to start, I think, with actually, this aligns with one of the questions, so maybe I'll merge them. You actually showed us something from the English National Health Service where they talked about caring for our planet is the same as caring for our patients, and you said maybe not. And I think this is in line with a question from Bruce Snyder about the collision of patient choice and life preservation values with limits to care. So I don't know if you want to extemporize on that a little bit. Is this really about conflicts that we're going to have to resolve in favor of the environment? Are these, is that the proximate challenge, or is that a more distal challenge? How would you?
Well, Dr. Snyder would ask a question like that. Yes, I think we like win-win kinds of things and we go for them. Compromise is often a virtue, yet the conflicts are also real. In the long run, for most people, dealing with climate is very important. Our lifespans, especially for the young, say born today, will run into the end of the century. So dealing with mitigation of climate and adaptation of healthcare are very important in the long run. Today, this weekend, while say covering staff are working at the hospital, can't really consult on what needs to be done and so on. I think really need to focus on the patient and immediate concerns. So I think that part's right. What we need to do is manage our organization so they're in a context in which these things work out well in the large. So I think it's partly an organizational problem. And in there, we also see the cultural problem that we need to have concepts that help people understand what needs to be done, while at the same time have practices that are realistic about what needs to be done. So yes, I think we should think of many of these things as conflicts because they really are, and people are conflictual about them.
Well, can I pick up on that before I go to the questions that are coming in? One of the first times I talked with an environmental engineer, sort of who assesses the environmental impacts of things, and I talked about healthcare. His first reaction to me, which has stuck with me, was maybe healthcare should be the last social institution that we ask to constrain its environmental impact. We should do everything else before we go there. So this is a classic question for a philosopher and an ethicist. How do you approach that?
I think if I were politically smarter, I'd say, absolutely, that's exactly right. But I'm a philosopher and I think, okay, if we hit the hard problem and solve it, then problems like having fewer shoes or flying less or ships with sails and doing some sort of center and what's the right, I know there's a right word for this, simplifying transportation patterns, living closer together, bigger households, better insulation will be a lot easier. And healthcare is very much integrated with the industries around it. So in some ways, it has to be somewhat passive with regard to what's available. But certainly people in healthcare are active in concerns, says we need to lead here. Right. And if you lead mainly by telling everybody else what they ought to do, and you're not talking about your own industry, somebody's going to say, you hypocrite. And they're kind of going to be right. A lot of people in healthcare are well paid, live very ample lives, and in some ways are unsuited to leadership, where global poverty is the dominant pattern. So I'm skeptical about leadership, and also think it's important that for consistency, the leaders do work on healthcare, and it is hard. And that's why I think we should do it first. Because if we can't solve it, then we can't solve the other problems because they have to support healthcare. Right.
So a comment from Paul Cummins, which I think you might want to reflect on, or a couple actually.
Oh yeah, I'd love to hear. Hello, Paul. Very nice to hear.
In addition to this being great, I thought that a focus on the short-term immediate effects of the climate crisis is one way that philosophers can shift ethical theory. Too much philosophy on environmental ethics treats this as an intergenerational problem and turns this into sort of an esoteric issue in a way. Is this a place where philosophers can help to shift the ethical theorizing?
Yeah, I know who I'm going to shift. I think both things need to be said. Jessica and I kind of like the long view because we do think it's important and it involves the earth and its ecosystems. But yes, it's also an emergency. Things urgently need to be done. And I think clarifying that for people and indicating not only that there are short-term problems like methane blooms, and I think the terrifying problems of migration for everyone, either people who stay home or people who move and where people arrive, the changes in capacity to do agriculture, bad water, they're right here and now. And I do think coping with local poverty and such, and finding healthcare that can serve people in that situation better is a really good idea. So thank you, Paul. I don't think I've said that strongly enough.
Right, right. Okay, I know I asked you to speak about the limits issue. Again, I'm taking the privilege of the chair here. But as you know, the limits to growth discussion has a really problematic political history, particularly with respect to discussion of population, or perhaps, I don't know what your thoughts are. And as we know, numbers of people are not really the issue. Certainly discussions of majority populations, which I think is the phrase being used for the global South, needs more of the Earth's resources, so the idea of convergence. Yeah, right. But do you think we've overcome the problematic politics of the language of limits? Do you think we're able to sort of talk about limits now in ways that don't? It's a thing that troubles me, so I'm very interested.
Who's we here, Fiona?
All of us. I guess I grew up politically with a real anxiety and concern about some of the language of the limits to growth and the population control agendas that were often associated with that.
Yeah. There's things I have liked. In 95, when the large International Women's Association really emphasized the need for women to control reproduction and to enable that. That helps. Not often said, I think big households could be a big help. One child to a couple makes the family a little bit small, but if you have, say, 4 people and 2 children, you're starting to have a village to raise a child. I did some talks at the APHA around 2000 on population issues, and I think I was working off of Joel Cohen's work where he surveyed estimates of demographers and basically said that the Earth is at a level of population at which you can expect some trouble. And when we think of the areas which are most vulnerable to climate change, so basically the tropical areas of the Earth, where a lot of people live and many have no place to go, this is, I think, very much important. It's easy in a way to have fantasies of there being fewer people, but there's no humane way for that to happen, except by a higher death rate and a lower birth rate over decades to centuries. And I think many who have guessed what will happen is that will happen. But that is not a pleasant prospect. I don't know if that's helpful.
No, that's fair enough. I'm going to ask another question, which is again from Paul Cummins, which is about is there a tragic divide? I'll make it a question between public health ethics and clinical ethics. Is part of the solution here bringing clinical practice, research, and public health together more effectively, perhaps an ethical?
Well, that's where we started. Yes, absolutely. Absolutely. That will help, but that won't obviate the need for healthcare.
Right.
And if you look at the Code of Ethics for Public Health in the US, anyway, I think it way too emphasizes some of the values of healthcare and needs to be revised with a better sense of respect for the environment and less emphasis on, shall we say, getting people to the doctor when it's appropriate.
Right.
Or eating very nutritious diets that are very costly. Or living in a safe neighborhood where you have to commute somewhere else, and all of those kinds of things that I think public health has some work to do, as well as healthcare in ethics.
Fair enough. So I'm going to ask you for any final words. I think we're out of time at this point before I hand you back to Andrea Bianchi to close the session. What are perhaps the final things you'd like to leave with us?
No, I hadn't thought about this, but one is, I think the things that we need to do, and here I mean mostly people who are well off. Mm. And I don't mean individually, but in terms of policy, organization, and commitment, need to learn how to wind down some of the industrialization of agriculture and life that's already occurred. And I do this little sing-song. I say, you're not going to like it. You're not going to like it. And I think in some ways, where you go there, philosophy is really a big help. You know, I remember a comment by an old man when I was doing geriatrics. He said, I'm really, really old and I'm falling apart. And it's so interesting. And humans have a capacity to find meaning in many, many circumstances. And it's going to be more stressful. And I think philosophy has classically been one of the ways we find to make meaning out of stress. And it has a sort of elegiac function. It's intergenerational. And what we say and think today, whatever the tragedies, as, by the way, wonderfully memorialized in the Human Rights Museum in Winnipeg, gives through the years to future generations. So this is good work.
Wonderful. Thank you. Andrea.
Yeah, thank you so much for those concluding remarks. That was certainly impactful. And just thank you for that presentation and discussion. As a clinical ethicist, you've certainly given me, and I'm confident many others, a lot to think about. So thank you for that, Dr. Jameton. And so, of course, now it is sadly time to draw today's seminar to a close. I have a couple of short announcements before we formally thank our speaker. So our next seminar will take place, the Joint Center for Bioethics seminar will take place on March the 30th, where Quinn Grundy and Daniel Buckman will be discussing Canadian big cannabis companies and the financial sponsorship of scientific research. To sign up to receive our weekly seminar reminder emails, please email jcb.info@utoronto.ca. And as usual, CSB students who are enrolled in the CSB Student Seminar course, please do remember to keep track of your attendance. And so finally, I just want to sincerely thank the Center for Sustainable Health Systems for their partnership in hosting this talk, Dr. Fiona Miller for facilitating this incredible discussion, and finally, Dr. Andrew Jameson for your incredibly thought-provoking and important presentation. Thank you.
So thanks so much. It's been great. I put up, I don't know if you can still see it, my email at UMN, Jamet, JAMET004 @umn.edu if you want to be able to communicate with me.
Thank you so much.
It's been a great opportunity. Thank you.
Wonderful. I just